Welcome to Iowa Live, everybody. I am Lou, and I am back in Ankeny, hanging out at Central Iowa Neuropathy with Dr. Ole Olson as we talk about peripheral neuropathy and how he can treat your peripheral neuropathy. Let's start with the basics. What is it?
So peripheral neuropathy is really just damage to the nerves outside of our central nervous system. So central nervous system, brain, spinal cord. Peripheral nerves, those nerves that leave the spinal cord going down into your arms and fingers, down into your legs and feet, even those nerves going into your vital organs.
Really, and so it's the outside from the central nervous system going out. That's the word peripheral, then neuropathy. Now, what is neuropathy exactly?
So neuropathy is just any damage to those nerves. So it could lead to many different symptoms, such as burning or cold pain. Sometimes it's a sharp shooting electrical type pain. Sometimes there's no pain at all. It's just more numbness and tingling. Yeah.
So this is all nerve related. Is this something that happens to a nerve immediately? There's some kind of traumatic event that happens, or is this something that progresses over time?
Yeah, great question, and it can really be either or.
Really?
Sometimes there's a traumatic thing. If you had a spinal cord injury, right, that's an instantaneous thing. Right. So if you had maybe a knee surgery, they could nick a nerve or something like that, and you could create some neuropathy issues into the leg. Other times it's more of a chronic issue. So the most common type is diabetic neuropathy. So that's something where it could take weeks, months, years, even decades to develop. So we see people that have maybe 20, 30 years in the mix have been dealing with this. Chemo-induced neuropathy, that's one of those things where it can happen really fast, right? During a chemo session, that can happen. So that's the second most common type. Third most common type we see is what's called idiopathic neuropathy, really, which is a fancy doctor word for not really sure. There are about 100 different things in there, from exposure to Agent Orange for people that were in like Vietnam, different chemical exposures and toxins, even things like being on your feet for work for 40 years or sitting at a computer desk for 40 years.
Right, you mentioned chemical exposure or toxins. What about people that intake toxins or different chemicals? Would that be able to trigger it too?
Yeah, absolutely. I mean, there's even certain medications that have an increased risk for damaging the nerves.
Right. Now, the most important thing is maybe you've noticed that this is going on. Can you do anything about it? Can we, Doc?
Yeah, that's another great question. So, our office helps a lot of people. First and foremost, we got to figure out what is going on. We do very specific tests to determine, are they a good candidate for our program?
Right.
Because not everybody is. And I wish we could help everybody, but there are people that we're just unable to help. So if there's certain things going on or their test isn't showing things that we'll be able to help them with, they may not be a good candidate. And you don't want to wait too long. Once it reaches 85%, that's where permanent nerve damage is set in. And then there's things that aren't going to be able to be helped.
You talked about the individualized custom program. One of the first questions that people have is, yeah, but how long does it take before I can start seeing something happening? Is there a standard answer for that?
Not a one-size-fits-all answer. Typically these things take time. Nerves, there is no quick fix to the nervous system. Most people have been dealt different types of drugs and surgeries and injections and things that just haven't gotten them anywhere.
Right.
They just continue to get worse. Our program is actually stopping and reversing the neuropathy. So that does take time, but I would say most of our patients are starting to notice some changes even in the first 4 to 6 weeks.
Wow, that's rather quick. Now, you have a special offer that you want to make right now to find out whether or not they can help you. And how do we do so?
Yes, so our first step is we actually have a free seminar.
Great.
So they can come out and learn more about what it is that we do and learn more about their condition, because patient education is our primary focus. This seminar is absolutely free. The first 15 callers, they're actually going to get my book for free as well. It's called Reversing Neuropathy, How to Get Back Your Life.
All right, and that's 505-3700 number, 515 area code, of course, 505-3700. The next 15 people that call right now, you'll be able to get into the seminar, learn about the process, learn about how you can get it treated, and then start treatment right away.
Absolutely.
That's great. Dr. Ole Olson, thank you so much.
Thanks for having me.
All right, we'll be right back. This is Iowa Live.